hi guys. So I'm Katie Fathy, and we're going to talk about soft tissue in terms of POCUS today. So here's what we're going to go through. Basically, some of the techniques about how to actually do the scan, a couple of pathology, including cellulitis, abscess, foreign body, necrotizing fasciitis, and we're going to look at some pitfalls and limitations and some of the big hits in the literature. We are not going to talk about lymph nodes today. That's going to be part of it of another topic coming up in a couple weeks. Please feel free, guys, also to ask questions if you have them during the talk. So in terms of your transducer, you want your high frequency linear transducer. So the reason that you want this is you want shallow penetration and a lot of detail. So any of them are fine. There's also the hockey stick. So these are the two that we have in our department. Completely fine, or the hockey stick is great, whichever one you have, as long as it's high frequency so that you can see the great detail of the shallow area. In terms of other equipment, you're going to want to have a protective barrier, especially if the skin is draining, so you don't want anything on your probe. Tegaderm would be a reasonable thing to use, which is what we use here, but remember to take it off. If you're going to be doing sterile technique for any sort of IND or any procedure, then you can always consider your normal sterile technique. Other things like saline bags and water baths we'll go through in a couple minutes. Analgesia, as this is a very painful procedure, if you're going to be INDing, if you're just going to be scanning, you don't necessarily need analgesia, but it's always something nice to think of for the children. If you're going to be INDing or if you're going to be removing foreign bodies, then you're standard equipment for that. So in terms of the technique, here we have the child's arm. You want to have the transducer perpendicular to the area that you're looking at. So you can see, I know there's no cellulitis on this picture, but the idea is you're going to be perpendicular. You're going to be moving up the arm and then in a parallel, a 90-degree plane. As it is usually a painful site, use a lot of gel. So you almost want to have a floating transducer on top so you're not pushing down on the area and causing the child any discomfort. The other thing is you want to make sure that you have enough depth. So if you're only seeing 1 centimeter, that's probably not enough. You want to be down a couple centimeters, roughly 3 or 4, depending on the area that you're looking at. An arm with 3 or 4 would be completely reasonable. Leg, you might want to go a little bit deeper. So here is a picture of cellulitis on a child. So you want to scan in the transverse plane and the longitudinal plane. And it doesn't necessarily have to be exactly what the anatomic position is. So depending on where it is, you just want to make sure that you're going in a 90-degree angle to your scan. You have to go through all of the abnormal tissue. So you want to see from normal through abnormal and back to normal if possible. Depending on the anatomic location, that may or may not be possible. You also want to see all the borders. You want to see the bottom of it. You want to see all the sides of it. And that way you know you've seen the entire area. We'll talk about reasons for that in a couple minutes. The other thing you want to do is you want to put color Doppler on. So with this, you can identify the tissue a little bit better. So this actually might have a vessel near it. This actually, the thing you might be looking at might be a lymph node instead of actually soft tissue. So you want to make sure that you know what you're scanning. This is a child who has cellulitis. He basically has hyperemia, increased echogenicity of the tissues and thickening of the tissues. In terms of the Doppler, it's hard to know if there's increased flow or not because we don't have a comparison. So the other big point is to always compare your abnormal side to your normal side. You'll have a better idea of actually what you're seeing. So here we have the saline bag. Here's a couple examples. You can use your normal saline bags, the ones that are pre-made, or you can actually make your own. So a glove with some water inside. The reason this times is helpful is that you have an increased amount of fluid to be able to see your tissue. So sometimes you can actually get better definition of your tissues this way instead of putting the transducer right on the tissue. If the transducer is right on the tissue and you're looking at something very superficial, sometimes it's really hard to see. This is a better way to get visualization of that very superficial tissue. The problem with the saline bags and the homemade saline bag is that sometimes they have little bubbles in them, and so sometimes you're actually scanning through the air. And as you guys know, air is our enemy in terms of ultrasound. We can't see through it. So it is helpful, but make sure that you're not going through air. The other thing is it can be a little more painful because you are putting something more pressurized or heavy on the hand or on the tissue, so it could be slightly more painful. So things to consider when you're thinking about scanning the certain anatomical part. Definitely helpful for things that can't be submerged. So we'll talk about water baths in a minute. So things like chest, this might be more helpful, or parts of your leg that you can't actually put underwater. So here's the other example of the water bath. I love the water bath. It works very well. You can put arms, mostly hands and feet, into the water bath. It's harder for some of the other anatomical regions of the body. You want to put the probe into the water, and you can have a lot of space in between your actual tissue and the probe. The great thing, this causes no discomfort to the child, and you get beautiful pictures. You can see the anatomy very well. The only time that it's challenging is certain parts, especially the bottom of the foot, trying to get it in a way that you're not going to have the water fall everywhere can be a bit of a challenge. So as long as you can find a way to get the anatomical part in, it is quite helpful. So here is an example of a water bath. As you can see, the water is on top, so the black, the anechoic part on top with the little sparkles and through, which is basically just little air bubbles. And then they have the foot at the bottom. You can see the toes poking through, and then the base of the foot. This scan was done to look for a foreign body, which was a quite challenging scan. And I question if there's actually a foreign body in there or not right here versus bone. This child was sent to plastics in the end. So tips and tricks in terms of the technique. Ensure to scan all your borders and see everything. Use plenty of gel and consider your different imaging techniques in terms of better visualization for your tissues. Any questions about technique? No? Perfect. So here's an example of normal soft tissue. So here we are in the calf, and you can see moving from the very top. So we have skin, then we have subcutaneous tissue, fascia, the very bright layer right before the muscle, and then muscle underneath. Looks like you're a piece of steak that you would get in the grocery store. So this is all normal tissue. The reason it's normal, it has kind of like a moderate aquitexture. You can see all of the soft tissue all the way through, so there's nothing blocking your way to see the bottom. Everything is seen very well. It's not, and it's uniform, so everything looks the same, homogeneous, and you can see everything throughout it. So this is a completely normal tissue. Again, you're going to look at your normal side and your abnormal side to decide what's actually abnormal. So in terms of going through the types of pathology, we're going to go through some cases. Feel free to ask questions. So this is a 10-year-old male who has arm swelling, pain, and erythema. Maybe he had a mosquito bite before all of this. And when you examine him, he's got a discrete area, 5 by 5 centimeters of erythema, maybe some fluctuants, hard to tell clinically. Just so you know, these pictures coming up are going to be a compilation of cases. So they're not all actually an arm, but you're going to get the point anyways. So what do you guys think of this picture? Normal, looks like the other one, or abnormal?
Abnormal.
Abnormal.
Abnormal, why?
Thickened, yeah, and hyperechoic.
Totally right. So hyperechoic, thick, it looks a lot different than the other one that we've seen. And even as you're moving through, this kind of at the end, you see a bit of normal tissue. So you can see kind of from the beginning and the middle where it's thicker, it's more hyperechoic than the rest of the tissues. This is actually a cheek, which is why you're not seeing as far down. So the first signs of cellulitis are going to be increased epigenicity and increased thickening of the area. The next thing you're going to see is this. What is this called? Cobblestoning. Perfect. So this is the next stage. So kind of in the beginning, from normal tissue all the way through to abscess is a bit of a spectrum. So this is when you see the next stage would be cobblestoning. So this is interstitial edema surrounding the subcutaneous tissue. So you have these little islands of subcutaneous tissue which are surrounded by fluid, which is your edema. This is the progression of disease. And then what do you guys think of this?
Hyperechoic, cobblestoning.
Yeah, so you're totally right. This video is just kind of showing you the progression of normal. So let's wait till we get to normal. We're not there yet. The very beginning is normal. So it's starting from normal. And then you go all the way through to increased echogenicity, increased thickness, all the way through to cobblestoning. And you can see as you're moving through, when the cobblestoning is there, you're just not seeing the muscle the same way that you could see before. So it distorts the tissue below when you have cellulitis on top. This is a great comparison of kind of this 4 stages of soft tissue cellulitis and infection. So in A, we have a normal tissue, B, we have thickening, C, we have a cobblestoning, and D, we end up having an abscess. So it just shows you the progression going through. So it depends on where you're looking at, what part of the soft tissue infection that you're looking at. You might see all of this